A teenage girl walks into one of the most prestigious hospitals in America for a routine consultation. She never walks out.
Being in a psych ward without needing to be in a psych ward and just not being treated like everyone else was.
For over a year, her parents are banned from seeing her. The state takes custody. She's locked in a psychiatric ward. Her crime? She was sick. This is the story of how a family's nightmare became a constitutional crisis, and how one diagnosis destroyed everything. What you're about to hear sounds impossible in modern America. A 14-year-old girl, Justina Pelletier, is transferred between hospitals for a second opinion. Within 72 hours, doctors make a decision that will imprison her for over a year. Her parents are threatened with arrest if they try to take her home. Was this about protecting a child, or about doctors protecting their egos? By the end of this story, you'll question everything you thought you knew about medical authority, parental rights, and who really controls your body. But first, let me introduce you to the girl at the center of it all. Justina Pelletier grew up in West Hartford, Connecticut, an all-American kid with an all-American dream. She loved figure skating. She competed in regional skating events. Her parents and siblings describe her as energetic, joyful, and always smiling. Her older sister, Jennifer, had been diagnosed with mitochondrial disease, a rare genetic disorder affecting energy production in cells. It explained Jennifer's chronic fatigue, muscle weakness, and pain. When Justina started showing similar symptoms, extreme fatigue, muscle pain, trouble walking, her family and doctors at Tufts Medical Center suspected the same condition. Dr. Mark Corson, a respected metabolic geneticist at Tufts, had been treating Jennifer successfully. He diagnosed Justina with the same mitochondrial disorder in 2011. The treatment plan was working. Justina wasn't cured, but she was stable. She could skate. She could smile. But in February 2013, Justina got the flu. She was struggling to recover. Dr. Corson recommended bringing her to Boston Children's Hospital, one of the top pediatric hospitals in the world, to check on her gastro issues. It should have been routine. Linda and Lou Pelletier, Justina's parents, had no idea they were about to lose their daughter. Lou was a blue-collar guy. Linda was a stay-at-home mom caring for their daughters. They trusted doctors. They believed in the system. So on February 10, 2013, they walked through those doors expecting help. They wouldn't leave together. Justina was admitted to the gastroenterology unit at Boston Children's. The plan was simple: assess her digestive issues, coordinate with Dr. Corson, and send her home. But then, something changed. Dr. Jurian Peters, a neurologist assigned to Justina's case. He reviewed her history. He saw Dr. Corson's diagnosis of mitochondrial disease. And he disagreed. Peters believed Justina's symptoms weren't physical. They were psychological. He diagnosed her with somatoform disorder, a mental condition where patients experience real physical symptoms caused by psychological stress. One diagnosis said her cells couldn't produce energy. The other said it was all in her head. Lou and Linda were blindsided. They showed the doctors Dr. Corson's records, the genetic tests, years of treatment history. The new team at Boston Children's didn't care. To them, Dr. Corson was wrong. And worse, they believed the Pelletiers were making Justina sick. They suspected Munchausen syndrome by proxy, a condition where a parent fabricates or induces illness in their child for attention. Lou Pelletier would later say, "They told us we were harming her. That we were making her believe she was sick." I couldn't believe what I was hearing. On February 14th, Valentine's Day, Boston Children's Hospital called the Massachusetts Department of Children and Families. Within hours, the state took custody of Justina Pelletier. Her parents were no longer allowed to make medical decisions. They were restricted to 1 hour of supervised visits per week. And if they objected, if they tried to take her home, they'd be arrested. Justina Pelletier, a 14-year-old girl who walked into the hospital, was now a prisoner. And this was only the beginning. The Pelletiers didn't give up. They couldn't. Lou became a warrior. He fought the DCF in court. He hired lawyers. He did interviews. Local news stations began covering the story.
Liam, the Pelletiers and Children's had drastically different ideas about Justina's illness, what caused it, and her treatment. Children's Hospital told Massachusetts Department of Children and Families that the teen suffered medical abuse, touching off an almost year-long court battle.
A Connecticut family claims Boston Children's Hospital kidnapped their daughter. But the system fought back. Every appeal was denied. Every motion dismissed. The judge sided with the hospital over and over again. And while the legal battle raged, Justina was withering away. Remember, she walked into that hospital. Now, she couldn't even stand. Boston Children stopped all of Dr. Corson's treatments. No more medications for mitochondrial disease. Instead of therapy, psychiatric drugs, behavioral modification. She drew pictures begging to go home. She smuggled messages to her parents. She was treated like a psychiatric patient, not a sick child. And the hospital claimed it was all for her own good. Dr. Alice Newton from Boston Children's Hospital testified, "We believe the parents' insistence on a physical diagnosis is harmful to Justina's mental health." But here's where it gets even darker. Journalists started digging. They found something disturbing. Around that time, Boston Children's Hospital had conducted studies on somatoform disorders. Some outside observers began to question whether the hospital's growing focus on psychological diagnoses was influencing how certain cases were handled. It raised an uncomfortable question: was Justina being treated as a patient or as part of a research trend? Was Justina a patient or a case study? And there was something else. Boston Children's and Tufts Medical Center operated under different philosophies, and some observer wondered if professional pride played a role. Two hospitals. Two teams of experts. Two conflicting diagnoses. And one child caught in the middle. And while the adults fought over who was right, Justina lost an entire year of her life. By 2014, the story exploded. #FreeJustina became a national movement. Thousands protested outside Boston Children's Hospital. Civil rights groups got involved. Politicians took notice. Even media personalities like Glenn Beck put pressure on the state. He said, "This is government overreach at its absolute worst." Finally, the governor of Massachusetts got involved. And suddenly, after 16 months, the DCF changed its tune. On June 18, 2014, the state returned custody to the Pelletiers. But here's the twist nobody talks about. The state never admitted wrongdoing. Boston Children's Hospital never apologized. In fact, as part of the custody agreement, the Pelletiers were initially gagged, forbidden from speaking publicly about the case. Lou violated it anyway. He later said, "I don't care if they throw me in jail. The world needs to know what they did to my daughter." When Justina finally left Boston Children's, she couldn't walk. She'd lost significant weight. She was traumatized. The hospital that claimed to protect her had destroyed her. Dr. Corson immediately resumed treatment for mitochondrial disease. Slowly, Justina began to recover, proving his diagnosis had been correct all along. But the damage was done. In 2016, the Pelletiers sued. They went after Boston Children's Hospital, the DCF, and everyone involved. The case dragged on for years. Finally, in 2021, 8 years after Justina was taken, they reached a settlement. The terms? Confidential. Boston Children's Hospital never admitted fault. No doctors were disciplined. The system that enabled this continues to operate exactly as it did before. Justina is now in her 20s. She still struggles. She still uses a wheelchair sometimes. The trauma, physical and psychological, will never fully heal. But here's what haunts me most about this case. Every year, thousands of families face medical custody disputes. Parents lose rights over disagreements with doctors. Justina's story isn't unique. It's just the one that went viral. So ask yourself this. If you walked into a hospital tomorrow with your child, and a doctor decided you were wrong, could you stop them from taking your kid? The answer should terrify you. Justina Pelletier's case exposed the terrifying power imbalance between parents and the medical legal system. It showed us that good intentions can lead to unimaginable harm. And it proved that in America, a hospital can become a prison if you disagree with the wrong doctor. So here's my question for you. Do doctors have too much power? Should parents ever lose medical custody over a disagreement? Drop your thoughts in the comments. Subscribe if you want more deep dives into the cases that expose the cracks in the system. Because stories like Justina's don't just deserve to be told, they demand to be heard. Justina walked into a hospital seeking help. She walked out, finally, but never fully came home.